Hello! Welcome to another episode of Dear Diabetes. Today we're going to be talking about sort of how to understand diabetes. To make sense of diabetes, it might help to start the symptoms. A common symptom of diabetes is fatigue. Many patients report not having enough energy along with making more trips to the bathroom. With this, you may start to notice you become thirstier and are drinking more water than usual. What's essentially happening is that the sugar in your blood is unable to get into the cells of your body. This sugar is glucose, a simple and small sugar. Glucose is used as an energy source for our cells. It's what allows us to move, think, and essentially function. Think of glucose like the gasoline we put in our cars. If our glucose is not able to enter our cells, then we are depriving ourselves from our fundamental source of energy, which explains why you may feel tired. So if glucose isn't entering the cells, that means there's a buildup of it inside of your blood. As glucose levels continue to build up, it will eventually pass through the kidneys, which is the organ responsible for filtering your blood, and will end up in your urine. As glucose goes through your kidneys, it picks up a lot of water with it, which results in the frequent trips to the bathroom. Now, if you're urinating frequently, you're losing a lot of fluids, which explains why you may be thirsty. So, what's the big deal? Well, excessive amounts of glucose inside your blood can harm your arteries. Arteries are blood vessels that carry blood throughout your body, kind of like an intricate system of railroads. When diabetes goes untreated, you can damage the blood vessels inside of your eyes, kidneys, and extremities, such as your hands and your feet. So let's dive a little deeper. When someone is diagnosed with diabetes, it means that insulin is not functioning properly. Insulin is a hormone in our bodies that moves sugar from our blood to the inside of our cells. When insulin arrives on the surface of our cells, it allows glucose to come inside, which will then be used by the cell. There are three main types of diabetes: type 1, type 2, and gestational. Type 1 diabetes is typically seen in children or young adults, but can also occur in older adults. In type 1 diabetes, the body's immune system attacks the cells that are responsible for producing insulin. Therefore, patients with type 1 diabetes must take insulin. In type 2 diabetes, making insulin is usually not the problem. The problem is that the cells resist insulin. Diabetes medications aim to help the cells become more responsive to insulin so that glucose can enter the cells. Gestational diabetes is similar to type 2, except that it typically occurs only during pregnancy and disappears after the first week of birth. However, it can be a sign for developing type 2. The good news is, new research has shown that diet changes alone can influence insulin sensitivity. Incorporating certain foods can decrease blood sugar levels and even reverse diabetes. My purpose of this project is to help share with you what those changes include and the best way to minimize the risk of diabetes.